Rheumatoid arthritis is an autoimmune inflammatory and chronic disease that mainly affects the joints. The immune system inflames the synovial membrane, increasing the production of inflammatory cytokines. The synovial membrane becomes thick and forms an inflammatory tissue called pannus, which invades and destroys the cartilage and bone.
The symptoms are inflammatory joint pains, weakness at wrist and improves with movement, morning stiffness lasting more than 13 and 16 minutes, swelling and morning in joints, and decreased strength and mobility.
Etiology. The exact cause is unknown, but is considered multifactorial. Autoimmune in origin, the immune system masculine attacks the synovial tissue. Genetic factor, highest risk in people with a family history. Environmental factor, viral or bacterial infection, may act triggers smoking on the main. Multiple risk factors is the most common in women, usually people between 10 and 15 years of age. Symptoms. The main symptoms are persistent joint pain, morning stiffness, lasting more than 20 minutes, swollen and increased joint volume, symmetrical involvement, example, both glands, local ones, and renal fatigue may occur. Classes in advanced stage is can cause joint deformities.
Tips of rheumatoid arthritis, two principles is seropositive rheumatoid arthritis characterized with positive blood markers indicate intense immune response with a higher likelihood of damage, and seronegative rheumatoid arthritis the patient has raw symptoms but blood tests do not show rheumatoid factor. Psychoparative training. This may include mobility exercise, gentle exercise to maintain range of mobilization, strength to improve flexibility, also strengthening exercise, specific exercise to strengthen the muscle around the affected joint using of resist bands or like weights. Also, manual therapy, so as massage to reduce muscle tension and improve circulation, joint mobilization to improve function.
In physical therapy, several therapeutic modalities help control and improve the mobility in rheumatoid arthritis. In the acute phase, we use cryotherapy applied for 10 to 15 minutes to reduce inflammation and joint pain. When inflammation decreases, we introduce thermotherapy such as hot packs on paraffin for 15 to 20 minutes. We also use stents and analgesic electrical current applied for 20 to 30 minutes, either for reducing pain and helping the patient move better. And for chronic phases, we can apply ultrasound in continuous for pulsed mode for 5 to 8 minutes per joint. They improve tissue elasticity and range motion.